Holly, it's so great that you're excited about AI, and as am I. And we also know that the whole industry is excited about AI and virtual nursing. But there has been skepticism from many nurses on AI, and particularly because it's perceived as a way to maybe increase ratio or take over their jobs, or as you alluded to it, taking away their decision making. How do you think about that concern, and what would you do, to alleviate that?
Well, it is real. We do know that. And I think it is exposing nurses to what you're trying to achieve. Using, again, a short video or a core team that's going on a site visit that sees what's happening at hospitals that have implemented this and getting feedback from people who have worked with it before. There's nothing better than someone, in your department, your unit, or hospital that has already had experience with virtual nursing to be a good supporter. I also think that it is really important to build virtual nursing with the voice of the nurse. They're much less skeptical of what it is if they've been able to design the implementation, as well as what are the key clinical things or visual things that you really want AI to do for you. Mm-hmm. And then sharing success stories. Open every meeting with a success that you've had with a virtual nursing experience, making sure that you're sharing the impact of it, because nurses want to make an impact. And if AI is helping them do that, then they're going to adapt it much easier. And we just need to tell the success stories time and time again.
Yeah, it's such a good point. And I think I'm hearing throughout this whole discussion that bringing the nurses in and really starting with them, and I think that goes with AI as well. And being a nurse myself, I understand where they're coming from, and I also agree with you that just education on AI and getting a little more familiar with it, and that is exactly involving them. So I think that's huge.
I want to start. It can't be. I'm sorry. It can't be a stick. It needs to be a carrot.
I think, Holly, you started this webinar with a point that I think is really relevant here, which is like, if we can do things like help nurses be safer in the rooms with AI, which we absolutely can, by giving them the ability to kind of communicate and by just watching for them. Like, hey, we can tell people are yelling in this room, and being able to kind of provide an additional set of eyes on that patient so that they're not, exposed in a dangerous situation. Those are great examples of where it's a real asset to the bedside versus it's just something that you're doing to me to change my job. I think that's a wonderful example of how we can make it more tangible. But I do want to pull to the dark side of this for a second, which is nurses have seen a lot of technology and people say, oh, no, it's great. It's going to make you more productive. And you're like, yeah, it did make me more productive. But then you piled on a bunch more work. You changed the number. If you were a CNO today, and you're like, hey, starting to see value out of virtual nursing, and you're like, no, the answer is not to now add more work. The answer is to use that to create longer term value levers like throughput and patient care metrics. How do you make sure as a nursing leader that it ends up that way versus, hey, this is looked at as just another stick that we start with a carrot and we end up with the stick?
I think you have to be very careful in not selling it in how many minutes nurses say. It's because then when you save it, someone wants to take it away and then give you something else back or take away a caregiver. You have to sell it as a way of, one, being more proactive, because in any time in healthcare, we can be more proactive. Generally speaking, the outcomes are better. The patient becomes more well in a shorter time frame. There isn't as many complications. And so the savings then begin is, I believe, we need to have more peer-reviewed studies on what's the impact of length of stay with virtual nursing, because I don't think we need to have that a little more science related to that. I am certain there's the outcomes, but really starting to do some peer-reviewed literature in this way, of which here's how virtual nursing has helped our patients or the operations or the nursing workload without feeling we need to substitute that or change the staffing pattern because we saved 8 hours of time that day. So it can't be an arithmetic approach. It really needs to be a quality of care approach.